Good morning, Mom. I'm Ella Macy Aranwes. I'm your nurse for today. I'd like to examine the nerves around your face and head. Would that be okay with you?
Yes.
At this point, I'm making observations to the patient to see if I can see any abnormality in the cranial nerve distribution. So this might be something like ptosis, strabismus, lack of expression, salivation, muscle wasting, or the facial asymmetry. The first cranial nerve is the olfactory, which is responsible for the sense of smell. Have you noticed any abnormality in your sense of smell?
No.
The patient complains of anosmia or the taste abnormalities. This can be explored using a smell testing kit. The optic nerve is the second cranial nerve. The tested components is the visual acuity, visual fields, and the fundoscopy, which is tested using the ophthalmoscope. I will test the visual acuity first. If the patient wears spectacles, then the testing is done with the patient wearing them in order to correct any refracted errors. I'd like to test your visual acuity. Can you tell me whether you wear spectacles, please?
No.
Okay, I'd like you to read some print up here. Could you take this in your hand and cover up the right eye? Could you read the top line?
Way back when mother of Ian King was pregnant of him, his mother thought that it was a baby girl, since there is no ultrasound at that time.
That's great. Thank you. Just use a special chart which is likely to available in a special clinic. If you are doing the testing at the bedside in something like a magazine or a book, would suffice. If you find an abnormality of visual acuity, then you may choose to use a Snellen chart in order to quantify the defect further. I know to test your visual fields. Could you cover your right eye with your right hand, please? I'd like you to look and concentrate in the counter of my eye. I'm going to bring my finger in. When the finger moves, I'd like you to say yes.
Yes. Yes. Yes. Yes.
So, when I'm doing this, I'm comparing the patient's visual field with my own. Could you swap your hand now, please?
Yes. Yes.
If an abnormality is detected, a formal visual assessment by perimetry or the central field assessment would be organized. In fundoscopy, it is best to dim the lights in order to allow people to dilate and to task the patient not to look directly at the beam so that the eye stays in a fixed position. The cranial nerve 3, 4, and 6 are usually examined together. Tested components are the ocular movements under the pupillary reactions. So first, I look at the ocular movements. I check at the normal resting position of the eyes and then the full range of movement. Alright, I'm going to test the movement of your eyes now. Please, what I'd like to do is you get focused on the tip of my pen and I'd like you to follow with your eyes and keep your head still. I'd also like you to tell me when you see double at any position. Okay?
Okay.
So, if you just follow my pen, I'm taking the patient's eye movements to the extremes of horizontal gaze first, and then examining the vertical gaze at all stages. I'm looking to see if there's any nystagmus in any particular position. I'm now going to test for the movements of the oblique muscles. Okay, so you didn't see any double in any of those positions?
No.
Okay, thank you. Looking at the individual nerves, in turn the abducens innervate the lateral rectus muscles. which are responsible for the abduction of the eye. When the patient has left 6 nerve palsy, the lateral rectus muscle will malfunction when the patient looks horizontally to the left side of the left eye, will not abduct normally. Patient will complain of double vision and the images will be horizontally displaced. In the cranial nerve core, the trochlear nerves innervate superior oblique muscles, and its action is demonstrated by asking the patient to look downwards and inwards with a left fourth nerve palsy. There will be a weakness of the left and superior oblique when the patient looks downwards and inwards. They will complain of double vision with oblique displacement of images because the double vision occurs on looking towards the right. The patient tends to feel that there's a problem with the right eye rather than the left. All of the other eye movements involve the ocular motor nerve. These nerves also innervates levator palpebrae superiors, where weakness will result in ptosis in the full picture of third node palsy. The pupil will be dilated and the eye will deviate downwards and outwards. Can you follow the pen again, please? As the eyes converge, both pupils are seen to constrict. Cranial nerve 3 papillary reactions, light reflex. The light reflex involves the perception of light by the afferent fibers of the optic nerve, with the efferent parasympathetic fibers carried by the third nerve. I'm going to shine a light into your eyes. I'd like you to look out into the distance place. So I'm going to test the direct and the consensual light reflexes in the direct reflex. So I shine the light in the right eye. And the right pupil constricts. So I shine the light in the left eye. And the left eye constricts. Left pupil constricts. Fifth nerve is the trigeminal. It has both sensory and motor components. Light touch sensation is tested in the ophthalmic maxillary and the mandibular divisions. I'm now going to test the sensation on your face. So I'd like you to tell me if it feels the same on each side.
Yes. Yes. Yes.
Okay. The corneal reflex involves afferent fibers from the ophthalmic division of the trigeminal nerve and afferent for the facial nerve. Correctly, I touch the sensitive sclera. No response occurs, but when correctly I touch the cornea, a bilateral blink responses obtained if this test is uncomfortable. It can be omitted if sensory impairment is not suspected. The motor function of the trigeminal nerve is to innervate the muscles of mastication. To test your jaw now, can you please clench your teeth tight? Keep clenching. I can feel the temporalis muscle. Contracting and contracting again, please. I can feel the masseter contracting. Can you please open your jaw? The pterygoid muscles open the jaw in the midline. Could you keep it open for me? The pterygoid muscle is strong. I should not be able to overcome this movement. Thank you. Your jaw from side to side. If the right pterygoid muscle is weak, the jaw will deviate to the right. The left is weak. It will deviate to the left. Okay, thank you. Cranial nerve 7 or the facial. The facial nerve innervates the muscle of the facial expression and the buccinator. I'd like to test your facial muscles. Could you please raise your eyebrows fully, please? And we are looking for the wrinkling of the forehead due to the construction of frontalis muscle, and this should be symmetrical. Now screw your eyes tight together. We are testing the orbicularis oculi muscles, and I shouldn't be able to open your eyes. Okay, thank you. Now, can you smile like this, please? And I'm looking for the symmetry of the smile and equal action of the orbicularis oris muscle. Okay. Now, can you blow out your cheeks? This is a function of the vaccination muscle. I press gently and see if there's any incontinence of air and escape of air from the mouth. The eighth nerves is the vestibulocochlear. It has auditory and the balance function. Test your hearing. I'm going to cover your one ear and whisper to other. Would you tell me what number it is?
46. 39.
Okay, thank you. Hearing deficit, I would move on to the turning fork test. It is the Weber's test and the Rins test. So both of these tests rely on the fact that normally the air condition is better than the bone condition. If the air passages are blocked, then air conduction will be reduced. And this conduction deafness, if the auditory nerve is affected, then both modalities will be reduced, and this is the sensory neural deafness. Bulbar nerves, it is the cranial nerve number 9, the glossopharyngeal, cranial nerve number 10, the vagus, and the cranial nerve number 12 is the hypoglossal. The bulbar nerves are conveniently examined together. I'm going to test your mouth and throat. Can you please give a loud cough? Cough test is for the cranial nerve number 10 to test the vagus nerve. Okay? So now I'm going to test for the articulation, which involves the coordination of the lips, the teeth, and the tongue. And it requires the facial vagus and hypoglossal nerves. Could you say the days of the week?
Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday.
Okay, what I'd like to do now is to examine the back of your throat. Could you open your mouth wide for me? The soft palate should move upwards essentially to protect the nasal pharynx when the patient swallows. The soft palate is pulled to the stronger side. The gag reflex is elicited by gently touching the posterior pharyngeal wall on each side and results in a gag response. So, that's all for our cranial nerve assessment. Thank you for your cooperation, ma'am.